Oh, so do you live with my mom?
Yes.
Oh,
Yeah.
okay, okay.
Yeah. So we work
I
in the same week. We work together. Yeah.
Oh, okay, that makes sense. So you guys are both
Yeah.
off right now.
Yeah.
Yeah, basically I go to NC State and me and some of my friends, we started STEM Journal Club so
Sure.
people can like present research and start to learn how to start learning research skills. And then with COVID-19, there's a lot of research coming out about it. And
Sure.
this one person was really interested in writing a blog post about the different COVID-19 vaccines. And I was like, well, it'd be fun to get some like personal experiences of like
Sure.
people who have actually gotten it.
Sure. Absolutely. More than happy
Yeah.
to help you.
Oh, thank you.
You know,
um, okay, I wrote down some questions.
sure. Absolutely. Take your time. I have nothing to do. I got my
Thank
coffee mug, so
Oh, my mom only drinks chai. She doesn't like coffee.
yeah, she doesn't drink. Yeah, I'm a coffee lover, but at home,
I
like we drink chai, but I got used to black coffee.
Yeah, she says at the hospital she drinks black coffee, and I'm like, Mama, you? No. But did you previously get COVID tested, and how was that experience?
Very bad. It's
Really?
I got I got it checked at least 5 or 6 times.
Mm,
Not because I had any symptoms, but it was due to many reasons. There was a cluster at the hospital, so we had to be checked before we
mhm,
came to the hospital just to make sure that we ensure the safety for others as well. It's kind of painful, but at the same time, like, we're all involved in this, we're all in this together. We have to worry about other people because we see patients who are already sick and we don't want to
mhm,
transmit COVID, because what we are hearing is, you can be asymptomatic as well. So that was the
mm.
main reason for us to have it checked. So as like I said, I think I got it 5 times checked.
Oh, wow. And
Yeah.
was this like the week that you were off before you came back to work? You had to go get checked?
Yes, yes. I think, I mean, if there was a COVID, I mean, if there was a cluster, or if they
Mm-hmm.
think that we might have, so one of the, I'll give you an example. So we have like patients on different floors.
Mm-hmm.
On one floor, there was a patient that was seen by different physicians, like you've seen that, your mom and myself, we work a week and then we are off a week. So there are like multiple physicians taking care of the same patient.
Mm-hmm.
If the patient is turned out to be positive, and even though we were wearing masks and everything, they want to make sure that we didn't get COVID, so we had to be checked, and this happened at least 4 times.
Oh, wow. That
Yeah,
seems, yeah, it is stressful. Did you ever worry about like working and then coming back home and like infecting your family? Was that like a big
absolutely.
worry?
Yes, that's it's a constant worry, even right now, because I was off day before yesterday. I mean, like
Mhm.
my last day was like day before. I'm still staying away from the kids. I don't try to touch them. I live in a separate room. I have got my restroom is no one is allowed to go into that room.
Mhm.
Um, it's just like, it constantly worries you, because I got the vaccine. I don't know
Mhm.
if I can still be a carrier, and I want to
Oh.
give it to my wife and kids. And unfortunately, everyone has been affected in some way with this COVID.
Mhm.
In my situation, I had personal loss, like, my father-in-law passed away from COVID. So yeah, and one of my uncles right now is struggling, and I don't think he's gonna make it. So everyone has been involved, and we have, had some personal loss, so I know how it feels like. And it's always in the back of your mind, whenever you come home, um, kids, and I have like 5 and 7-year-old kids.
Oh, so they're young.
So they're very young, when I come home, this is one of the situations where, because we are, I mean, even now, they all sleep with me. But
Mhm.
since this COVID, it's been like, different situation. And my elder daughter, once she came to me and was like, Dad, don't you love me anymore? Like, this is kind of like, it's very emotional, very, so there were like a lot of things going on, so which stresses you a lot. So yeah, so that's
Yeah. On the other
uh,
side, like, not being a dad, like, having online schooling, and I've
mhm.
seen like, I work at a COVID, express test clinic in Raleigh, and there's, like, 3-year-olds and younger, like, getting COVID tests, and
Yes,
I'm like, "This is insane," like, they have to grow up with this,
I
and I
know,
think
I
it's
know.
gonna be, like, generational trauma, low key, because
Yeah,
their
I know.
childhood has been, like, so different.
Yeah, so I think my 5-year-old daughter,
Mhm.
that she's in kindergarten, so she was excited to go to school because she was seeing her elder sister go to the school, and she would always show, "Oh, this is the school I'll be going, Dad," and all that stuff. And all of a sudden, she realized like it was virtual for a while. So, but now they're going to school.
Oh, now it's open?
Yeah,
Okay.
so I think they've started a couple of months ago.
Mhm.
So we had to make the decision so that they can go,
Yeah.
because my wife is also working, and
Yeah.
Marvin schools is a little different, because once you make the decision, you stuck with the decision for the rest of the year. And
Mm.
because I work, and if my wife is asked to come to the workplace, then
Mhm.
we couldn't change the decision, right? So so we were forced to make the decision. We were not excited, but
Oh.
yeah, it's kind of a challenge,
Mhm.
but at the same time, like, we're also happy that they're going. Hopefully they don't get anything.
Yeah. Wait, so
So
do they have to get tested or anything or no?
so far they did not.
Oh, okay, okay.
So far they did not. Knock on the wood, they don't have to.
That's
Yeah,
good
because
though.
yeah, it's pretty traumatic, painful.
It is painful. I just had to get mine done.
I'm sorry. Yeah,
I was like, "Oh my."
yeah. I mean,
Oh,
if it doesn't hurt you, probably they didn't do it right. So
yeah.
that's it.
I think, like, at NC State, they're letting you do self-test, and
Hmm.
I don't know how accurate that is because you can just go like that
Hmm.
and then just put the tube back. Like, if someone else
Yeah.
isn't doing it to you, you're not gonna go, like, all the way
Exactly,
up.
exactly. Yeah. So I think you can, yeah, there could be some errors.
Mhm.
Yeah, that's true.
But, which vaccine did you get and why?
Um, so this is what I look. So they were, we had only one option, Pfizer.
Mhm.
But honestly, I didn't care. I just wanted to get either of them, whatever, whichever I could get it first.
Mhm.
Because at least from what I did, from the research, what I did, the efficacies of both are almost the same. So again, to answer your question, Pfizer was the only option that we had. There was
Oh, so
nothing like,
then
we didn't have any option to choose and pick or something like that.
but both you say are, like, pretty similar, like, the
Yes,
side
yes.
effects and stuff.
Yeah,
Oh,
yeah. Side effects are similar. Even the accuracy rate is like, almost similar.
mhm,
Maybe one plus or minus one here and there.
mhm.
Nothing significant. The only thing what at least what I was looking is, Moderna vaccine. What they're mentioning is it not only provides immunity but also prevents the spread. So that was one thing that they are doing on the phase 3 clinical trials, which Pfizer is not doing.
Oh, okay.
I'm not. I'm learning more about it, but that's what I heard last.
Do you feel a little bit like a guinea pig? Like the first to test it out? Since healthcare
So
workers got it
absolutely.
first.
I mean, like, I totally understand what you're getting at, but this is how I look, especially with seeing COVID patients actively, and seeing my family members getting affected by this. I would rather get vaccine side
Mhm.
effects as opposed to getting COVID. So,
Okay.
so that's my take on it.
Mhm.
That's
I
what I
working
think.
with COVID patients a lot
Mhm.
can probably change your opinion. As
Absolutely, and I'm sorry.
Oh, no, you're good. You can go.
Yeah.
Was it mandatory for you to get it?
No, I don't think so.
Oh, okay. So it's not mandatory for
No,
healthcare workers.
no. I mean, because they cannot force you to make the decision, right? There are some healthcare professionals who are not inclined to get vaccine. They rather would wait for some more period before they take the vaccine. I mean, they have
Oh.
their own opinions, and again, I totally get where they are coming from, because it's they're like, we don't know what's going to happen, because there were a lot of social media news that
Mhm.
actually kind of
WhatsApp
came.
news.
Yeah, so yeah. So I mean, they were, um, I think a lot of news where they mentioned about like taking this vaccine can change you mRNA, and you can have some kind of autoimmune diseases, which is not true. But again,
Mhm.
no one knows for sure, because these are not something that was done on like long term basis.
Right.
Um, yeah.
Um, oh, like how was the experience of getting the vaccine? Like where did you get it? How was your mood when you were going in? Like how was the whole process?
So I think we have a great group, like your mom would have told you. So we have a great group. So we were like making lots of fun. So we heard one thing. What I heard before I was going, I think there was a case in Alaska where one someone had like anaphylactic reaction. I don't have
Yes.
any allergies or anything, but so one of my colleagues, she has some allergic reaction, so she always carries EpiPen.
Mhm.
So I borrowed her EpiPen, and I carried with me just in case if. But again, it was a foolproof thing, because there were like a lot of personnel at the facility. They were all equipped, they were all prepared should something where, and they actually make you wait for 15 minutes. I
Mhm.
mean, they won't force you, but they tell you it's better to wait for 15 minutes before you leave, to see if you have any side effects or you see any allergic reaction, so they can help you. But I carried my own EpiPen just in case, they got like,
Mhm.
freaked out or something. I can administer to myself. Um, but luckily, knock on wood, nothing happened.
Oh.
Fortunately, I didn't even have any symptoms. I don't know if it was psychological, but I felt little maybe dizzy
Mhm.
when I was thinking more, am I having any symptoms? But then, after a while, it all got away. I went to work, and the second shot after I had nothing.
So you've had both doses now?
Both the doses, yeah,
Oh wow, and you had no side effects.
nothing. Yeah.
Oh, so yeah, I heard one is better for people with allergies and one can like cause more allergic reaction or something. I'm
Oh,
not sure.
yeah.
I'm not sure.
I yeah, I have not heard about it. Um, yeah, I mean, you can be allergic to anything. It's hard to say. People can be allergic to eggs. People can be allergic to peanuts. It's just like that. Some people can
I
be
just
allergic to it.
developed my allergy reaction to shrimp, I think.
Oh, yeah. Actually, for the seafood, there are a lot of people who are allergic to, like, shrimp is very common.
Yeah, that's apparently what I'm allergic to, even though I ate it like every day of my not every day, but like I ate it a lot growing up. So now I'm
Uh-huh.
allergic. So
Oh.
I'm like, what happened? What changed?
Yeah, you start eating every day. You desensitize, and you're probably good. That's
No, my mom said, I'm gonna feed you one bite of shrimp and then hit you with the EpiPen and then feed you another bite. And then I was like,
okay.
Mama, I was like, what type of torture?
Yeah,
She's
yeah.
like, let's
Oh,
desensitize you.
yeah. I think desensitization is one way to go for it if you really love that food. Obviously, just like But did you have a like severe allergic reaction, or just
I so I had it twice only, but like the first time was prom night and
okay?
it was like 3, 4 hours after I ate
Oh,
shrimp. And then 2 years after, literally like a couple months ago, my brother makes shrimp,
mhm,
like Chinese shrimp and
mhm,
fried rice, and I eat it, but I only ate a little bit of the shrimp because like I could just feel something was off. And then 3 hours, like I wake Hassan, my brother, up at like 2 a.m. and I'm like, Hassan, I think I have an allergic reaction. And he wakes up and he goes to my mom and he's like, Rabia's having an allergic reaction.
wow.
And then
Yeah.
My like my mouth and throats, it doesn't like swell shut, but like all of
Mhm.
this gets rash and then like I
Wow.
swell up.
Wow. That's, yeah. So I think you have to be careful.
Yeah.
Sometimes anaphylactic reactions can be dangerous. So
Yeah, I
yeah,
heard
I
with
think,
shrimp it can get worse, like as you
yeah, yeah,
eat it.
yeah, yeah. I think I had one time, maybe, I don't know why. I think after I had shrimp, but I now I eat shrimp. I never had any other problem again. I don't know what
Hopefully that
happened.
happens.
Yeah,
I'm
but I
hoping
think
for
you
that.
should, yeah, you should always carry EpiPen with you.
Yeah, I
Yeah.
have it right now, thankfully. I
Okay.
always forget to bring it out though. I'm like I forget to
Yeah.
put it in like my bag and stuff, but I'll remember now.
Sure.
Um, so you didn't have any side effects. That's
No.
insane.
No.
Oh,
Yeah.
okay. Do you think
But
you got COVID before?
um, uh, it's actually interesting because you bring up this. For the whole of Atrium, I was the first person to diagnose the first COVID patient for the whole of
Oh
Atrium.
wow. Wow.
So I saw him. I just had a surgical mask then. I didn't have an N95 or anything like that.
Mm-hmm.
I saw him, I think maybe a week or 10 days later. I was working out a lot. And
Mm-hmm.
I think that week I still remember I was like, so exhausted, so dehydrated. I mean, I was not feeling good, like severe
Mm-hmm.
body aches. So my trainer and my colleagues were saying like probably you're drinking too much coffee and working out a lot. Maybe you're not hydrating yourself. Maybe like a muscle breakdown kind of picture, which I
Mm-hmm.
had it before a couple of years ago. So I was relating to that. I had some low grade fevers. Maybe I don't know. I'm not too sure. Yeah. So I mean, yeah. But at the
Did you
time,
ever
it
get
was so.
antibody test?
I did. That was like recently
Mm-hmm.
because I actually joined a survey where they
Mm-hmm.
send you the home kits so you can check it. I did check it and I didn't have any antibodies at the time.
You did or did not?
I did, but I did not
Oh.
have. I mean, it was negative, negative. So which means that I did not have antibodies.
Oh, so wait, but you've already gotten the vaccine. Doesn't the vaccine give you antibodies?
So I got this one checked before I got my vaccine.
Oh,
Now,
okay, okay.
again, so we also need to understand, even if I get the antibody test, I should be very specific about what kind of test I'm getting, because what this vaccine does is it actually raises your, like, it develops your end spike proteins and everything, right? So that
Mhm.
antibody test should be more specific to detect those things.
Oh,
That
okay.
at least that's what I heard.
So do you think that the antibody tests aren't as accurate as they should be
uh at least for the vaccine part.
for the
Okay,
okay, that makes sense.
and also, what we have understood about COVID antibody, people, like, let's say that I have a patient, he's infected with COVID and
Hmm.
he recovered from it. If he gets checked it after 3 or 4 months, he might be negative, because they're saying they're able to detect antibodies for the first 3 months after the active infection. So after three
Oh,
months, he could be still negative,
okay. So that
if
means
that
you could
makes.
get, so could you
Yeah.
get COVID again?
I mean, if you have recovered, we haven't
Hmm.
seen that. But
Hmm.
see, once your body recovers from the infection, it develops yeah, memory. It's just like a
Yeah.
vaccine, right? So if at all, if you're exposed to again, it's gonna react. So it's gonna act against it. So
Okay,
which
so
means
you
that,
can get it again, but your body's more prepared for it,
yeah,
so you
so
probably
yeah,
won't.
more prepared. Exactly, more like a vaccine.
Right. Okay. And then, oh, how have your family and friends reacted to you receiving the vaccine?
Excited.
Really?
So they say like, maybe you can meet us now, because some of my friends, they're not. I mean, they're not in healthcare, and some of
Mhm,
them are not seeing COVID patients actively because they're
mhm,
psychiatrists and those kind of.
mhm,
So they're pretty close friends. So they're more open to meeting us
mhm.
now. Uh,
Aw,
yeah. So
that's good. Wait, oh, do you have any skepticism about the effectiveness of the vaccine?
no, not at all. I don't
Oh.
even want to. I don't even want to entertain that idea.
You said it works, period.
Yes, it works. Yes, it's gonna work.
Hopefully. Well, so, do you think you're more open to seeing your like children and now that you have the vaccine?
um, yes and no, uh, because my second dose was like a week before, so I might want to wait a little bit longer. Uh, yes, to answer your
Okay.
question, yes. Yeah,
Okay, those are all of the questions,
sure.
but this interview was so fun.
Oh, thank you, thank you.
You had good. Yeah, my mom does say that the group is really fun and you guys
Yeah, we
always
have an
send
excellent
jokes.
group. Yeah, we
Oh,
have an excellent group.
yeah.
Yeah.
Wait, so did you all go get it together?
No.
Okay.
Because we have to, schedule the appointments.
Mhm.
Everyone had a different set of opinions. Some said like because we've been hearing a couple of our colleagues who were like almost like wiped out with severe body aches, really tired. It just like
Mhm.
wiped them out. So they wanted to get the vaccine when they're off, like. But I was kind of I wanted to get it when I'm working because if something were to happen, my colleagues would take care of me and get me. So
You're like, I'd already be in the
yeah,
hospital.
that was my thought process. So everyone is different.
Uh, well, I'm glad your experience was well and that you're still healthy and stuff and you didn't have any side
Yeah,
effects. That's the first I've heard of that,
I hope it's
honestly.
working. So that's the only thing.
Yeah.
So.
You hope they gave you a placebo.
I hope not. I hope not. No, no. They gave me the right thing. I'm pretty sure.
Pretty sure.
Oh, yeah. So,
There's a little bit, maybe. No, I'm just
yeah.
joking.
No, no. I don't want to think about it. So
Well, hopefully you get to like hang out with your families and friends now
sure.
that you got
Yeah.
it.
So
I
yeah.
My mom was very scared getting her test and
I
her
know. I know.
vaccine.
I know. I mean, it's a scary times. Even I was kind of scared, to be very honest. But like I said, I would rather get the side effects than COVID myself because I've been
Yeah.
seeing patients. So,
Yeah. Do
um,
you think that personally, I think that stuff like this is important because I think a lot of times scientists they know the information, but they don't know how to educate the public. And I think you need to
sure,
bridge both of those as someone in
absolutely,
healthcare or a scientist because
sure,
like the news and social media apps is how you reach them, how you
yeah,
reach the general public, but like
yeah,
those are, controlled by
yeah.
people who
I
don't know what
mean,
they're talking about.
exactly. I mean, and we've been seeing all these things like how they have managed. I mean, they could have done better, but again, it's easy for me to sit here and
Mhm.
say that. But
Mhm.
I think it could have been dealt in a better way. It
Yeah.
could have saved a lot of lives, and the people in responsible positions acted responsibly, which unfortunately was not the real case.
Yeah.
Yeah. So again, social media has bigger responsibility to carry out the messages, and unfortunately, due to I mean political reasons or anything, people have not. And WhatsApp has been and WhatsApp has been
Oh yeah, don't
yeah.
worry. I get those messages
Yeah,
like
because
even orange.
I don't know if you heard about it. There was recently a message in WhatsApp and all Twitter and everything about 23 elderly people in Norway got I mean like died after receiving vaccines. So that was the message that was conveyed. But unfortunately, that's not true. But
What happened?
so they were all due to other reasons why they died, but the way they portrayed the message was like they died after receiving vaccine, so which is not true. So I think they have to be more responsible, especially in this pandemic. You have to be so much careful how what you send the messages and not, because already people have so many doubts about and they're skeptical about getting this vaccine or not. And when because there could be some percentage of people who are just like on the border. Now when you hear these kind of messages, you wouldn't want to get the vaccine, right? So you're not inclined. So because one of the only ways we can prevent this one is everyone getting vaccinated.
Yeah. Yeah.
And if you're giving this, I mean, if it is true, then that's a different thing, you know. So they have
But
to be more
spreading
responsible.
misinformation.
Absolutely, you know.
Yeah. I think, yeah, I think that a lot of uneducated people are, it's easy to make a catching headline and spread it and get a lot of
Exactly.
views. No one's gonna
Yeah.
listen. COVID vaccine works. Like they want to hear like
Mhm.
COVID-19 kills thousands, blah blah blah.
Yeah.
Like that's more catchy. That's what people want to read. But
Yeah.
unfortunately, it sucks because then there's so
Yeah.
much misinformation, and I think like social media is just saturated with
Gotcha.
like like any bad, like yesterday, like me and my friends were talking about, and like there was a headline that was like taking your temperature doesn't really prevent COVID-19, like because you can be, as soon as you hear the word asymptomatic, like you could be
Hmm.
totally normal and have COVID and be a carrier and spread it. So
Exactly.
like just like, and she was like, why is this like a surprising news headline? Like like
Yeah.
we, everyone should know that taking temperature is not what's gonna like, you know, prevent COVID from spreading.
Yeah. I know. I know. Yeah. We had like we passed 400,000 deaths so far.
Yeah.
That's really, it's sad.
Yeah. But hopefully with like I like how they're doing it in like groups of people so that
Sure.
it's
Yeah.
like more systematic, but hopefully
Mhm.
like by the, you know, summertime. Do you think things will be better?
I think so. I think see again, you know, we have come to the situation where not everyone is inclined to get vaccinated.
Mhm.
I would be happy even if we can get around like 70% of the people get vaccinated. You can still prevent a lot of you know, deaths. You know, at least we can get to some kind of normalcy,
Yeah.
which I think it will take a little bit of time. You know, it's not going to be the same, you know, but at least I think I'm thinking end of this year there would be some kind of normalcy where kids are able to go to school, people are able to return to work, you know.
Aw.
So I hope I'm hoping for that.
For
Yeah.
a better future.
Yeah. So yeah. So that's,
Oh.
and by then we'll also know how the vaccine is working. You know, that will give us a
Mhm.
better idea. Yeah.
The effectiveness for sure. I
Yes.
think a lot of them are about to be approved through the FDA and stuff. So hopefully there's
Yeah.
more access as well.
Yeah. So because right now it's only an emergency
Yeah.
thing. Yeah.
But in Charlotte, they're doing like elderly are getting it as well now.
Yeah, I think there, because I usually attend these webinars, North
Hmm.
Carolina. So I think they've started for 75 and I think they're coming down to 65 plus.
Oh wow. Okay.
Yeah, so I think one of the I think the North Carolina, I think the vaccine coordinator, he was mentioning that they would be giving some of the like, you know, as far as getting the general public, I think they would also be involving primary care physicians where they
Hmm.
will be getting a, you know, a certain amount of vaccines and they can give to their own patients.
Oh wow.
So in that way, instead of like, you know, keeping everyone one place, I think it can distribute it. That was
Yeah.
a thought, that was a thought, but I don't know if they're gonna enact or not, but they
Hmm.
did mention. There was also concern because dentists were not getting it, so even they were including the dental because they're also, you know, taking
Yeah.
care of patients. Yeah.
And they're like working so close in their mouth and stuff. Like they
Yes,
should be
absolutely.
included.
Absolutely. Yeah. So yeah. Okay.